This video accompanies the paper, The SEBT, the Development of a Functional Screening Tool for Dance Educators by Margaret Wilson and Glenna Batson. In this video, you will find 3 case studies using the SEBT to identify performance errors in technique and expose potential or poorly rehabilitated injuries. The subjects are beginning-level college dancers. In each example, the dancer demonstrates a strategy for completing the test, which indicates a structural or habitual response to movement. The parallel orientation of the legs in this test poses a challenge for some dancers who more readily stabilize standing balance in turnout. Observing the dancer in parallel may reveal asymmetry or weakness in the lower body and may feel like a novel position for balancing. Example 1. This dancer reports a fully rehabilitated ankle injury and pain-free dancing. However, throughout the test, she voluntarily limits her range of motion, approaching each spoke with caution. Her focus is on precision, and she accomplishes this by turning the head and eyes before gesturing with the leg to the spoke, particularly to the back. Lack of core support and hip abductor strength is coupled with minimal knee flexion. Lack of knee flexion accentuates pronation and supination at the ankle. These factors combine to add stiffness and instability to the performance. While the dancer desires precision in the test, she overly constrains the movement for a safe performance. This self-limiting strategy may produce greater risk for injury or re-injury. Example 2. This dancer also demonstrates visual dominance by looking at the floor and specific spokes during the test. Maintaining an upright trunk throughout, posterior tilt of the pelvis, unilateral knee valgus, and eversion at the ankle are seen. This dancer's strategy is to pivot the trunk on the knee, which reveals apparent knee instability, especially to the open side spokes. He is using the knee as a fulcrum to compensate for limited lumbopelvic motion. For this novice dancer, there is a lack of understanding of the relationship between the trunk and the head, and the trunk and the lower body. When the trunk is upright, flexion and rotation are facilitated at the knee. Inability to maintain the ready position and difficulty stabilizing may be a feature of limited training. Example 3. This dancer is compensating for a poorly rehabilitated back injury by pivoting off the lumbosacral junction rather than showing full segmental sequential mobility. This is particularly evident in spinal extension. Precision pointing of the gesturing foot, rather than central or core stability, seems to be this dancer's predominant strategy. This dancer is moving her torso en bloc by creating a fulcrum at the hips. Despite reporting a pain-free back, this dancer compensates through repeated hyperextension, rendering the injury site as a fulcrum for movement.